All right, welcome. Hey, doctors of our personal injury doctors elite community. Another exciting event, another exciting endorsement. As you know, when you always see me on the big screen, I call it on the main feed, we're endorsing some great professionals and great services right into our community. And we're well over the 4,000 member mark, and I appreciate all the referrals, comments, and all the things you do inside our doctors community and make it what it is, number one on Facebook for all the doctors. But today, the stars are going to be our presenters today. You know, a lot of you have requested some things to enhance your practices in personal injury and maybe not even personal injury, just general practice that you can have into your practices, not only for patient health care, but also the bottom line to build some profit extra into your practices. So today we have a few professionals here, and we're going to introduce the CEO of Adia Nutrition, Larry Powalsz. Um, Powalitz, did I say right? Larry
That's correct.
Powalitz. He's the CEO of Adia Nutrition and great professional here with a lot of companies expansions and practice expansions with the use of some stem cell technology and premium supplements for healthcare needs. And we're going to introduce him to you. He's joined by his colleagues there, Jay Maha. He's the director of Adia in the sales department, Regen Ventures, and his brother, that's Mike Maha is with us today. So all different states, which is kind of cool to have. And I'm your administrator founder, as you know, and we're going to go ahead and turn the stage over to Larry first. And Larry, and all of you, welcome and for your time and education experience to bring all this to our doctors in this doctors community that we use to communicate a lot of things. So, all right, Larry, I'll turn it over to you.
All right, Dr. Tony, thank you so much. So again, like Tony said, my name is Larry Powalisz. I am the CEO of Adia Nutrition. We're a publicly traded company, trading under symbol ADIA. What I did about a year and a half ago is I became the CEO of this company. We added a medical division to Adia Nutrition. The medical division is called Adia Med, and the main product that Adia Med focuses on is called Adia Vita. Adia Vita is a stem cell and exosome product that I think a lot of you doctors are going to find very profitable and very exciting to offer your patients. Um, it's a advanced regenerative medicine that is the cutting edge in stem cells and exosomes. In the state of Florida, we just got a bill passed that we are allowed to market stem cells and exosomes. We can market for orthopedic treatments, for pain management, which can be huge for all of you doctors, and for wound repair. So within our product, I can describe our product very quickly. Adia Vita has 100 million stem cells, 3 trillion exosomes, which is greater than any other product that we've found in the country and actually in the world. And this is all minimal manipulation. It is all registered with FDA, and we do meet the GMP standards in manufacturing of the FDA. As far as the different things we can do with it, again, we can do orthopedic repairs. Somebody gets in a car accident, they're in pain. This is a huge anti-inflammatory. We can do things that are very similar to what pain relievers would do. We don't use pain relievers. We use stem cells to reduce pain. The concept of that is that we repair and don't just hide. We don't block a pain, we repair the pain, which is a much greater positive effect than constantly trying to give them medications to reduce pain. We're doing the next slide, Jay. Okay. Clinical applications. I had just been mentioning orthopedic repair and joints. If somebody had a tore ACL, rather than them getting surgery to repair that ACL, you can literally inject this in the joint and the ACL will repair itself. I have a wrestler, Jeff Shulo. He's a alliance from WWE. He just literally severed his tricep from his bone about 25 days ago. He had to get surgery because we cannot repair something that's completely severed. But after his surgery, we gave him an IV of Adia Vita. Within 1 day, he had no inflammation in his hand. Within the second day, his arm didn't have inflammation. His PT is telling him he has never seen such quick recovery, that he's like on the spectrum of 100% recovery within right now 25 days. He has full movement already, and the doctor expected 30 to 60% degree movement. So he's already in better shape within a few weeks. So pain management is what we were talking about. The main thing for your doctors, the um, personal injury doctors, a lot of patients are going to be complaining about pain. Rather than give them some kind of medications for pain, you would do an IV, a very simple procedure, um, giving them an IV to basically reduce inflammation. Once you reduce inflammation, you reduce the pain. And that is a huge thing as compared to doing cortisone shots, for example. And cortisone shots are bad for the body. This does not hurt the body, and there's no negative effect of using stem cells and exosomes. Want to go to the next one, Jay? Okay, the simple protocol for this. This is so easy to use. Basically, we use 10 cc's of saline. We start an IV, give them 10 cc's of saline to flush the veins. We then give them a 5-minute push of our stem cells and exosomes. Um, we do that slowly over 5 minutes because we don't want to take the chance of having them all stay in one area. We want the stem cells to go through their entire body. Then after we do that 5-minute treatment, we flush it again with another 10 cc's of saline. Again, we're trying to stimulate the stem cells they currently have in their body, give them young umbilical cord stem cells on top of that, 100 million of them. And then the exosomes are the communicators. We give them 3 trillion exosomes to have the stem cells we gave them and their own stem cells go to the inflamed areas and start repairing that inflamed area. Again, that's the magic of this, that the exosomes tell the original cells, stem cells in the body, and the new cells how to repair, where to go to look for damage and start repairing that damage. We'll get over a little more into how you can benefit, what kind of cost you can charge for this. But in most treatments, you can do, for example, say somebody had a tore ACL, you would take 25% of the vial, inject that into the knee to repair the ACL. The other 75% would be an IV. And that is, even though it's only one cost for the product, it is 2 charges to the patient because you've done 2 needles. So you can do, for example, one injection is $8,000. The additional injection is 4,000, it's $12,000, and that is for the same cost of the one vial of Adia Vita. All right, so I'm going to let Jay take over now. Jay, you want to go ahead and finish these slides up for these doctors?
Very good. Thank you. Thank you so much, Larry. Thank you, Dr. Tony. Thank you for joining us in the community. So we're going to talk a little bit about the support that we actually offer to all doctors that wish to work with us and to understand what we're doing. And obviously, we're looking for best patient outcomes and what's good for the practice. One of the things that we offer to everyone who participates and works with us is we have an extensive library of research. There's well over 120, I think the last count was around 126 different conditions that stem cells, exosome products have papers on, and we can support it. We have over 7,000 papers. So what we're saying to you, the proposition is, if you have a condition, if you have a patient, we will offer that to them so you can understand it, so you can see what research has been done upon that to strengthen your opinion to use it for certain conditions. 7,000 papers. You literally just contact Mike Maha in the future, ask him what papers, what research, evidence-based research that you can support it, and we will send those papers to you so you can make an informed decision of how to proceed. Also, we have comprehensive training. What we mean by that is we have an open invitation to all doctors that part with us and their practice to actually come to Winter Park, and they can actually observe how we go about treating certain conditions and patients. There is a myriad of different techniques that we can share, and then other doctors have shared with us and their practices would show us, and it's an open invitation. And in some cases, we have also done Zooms and video education to practices. So if you're unable to come to Florida, and if it warrants it, we can arrange teletraining for you and your staff. We can go into the details further in conversation. And then lastly, when you partner with Adia Nutrition, Adia Labs, and Adia Med, is that we also offer patient reviews. So this we find to invaluable to our doctors and their practices is where you can lean on us if you wish and to choose, and we can tell you how we have or how other doctors have treated a condition. And you can literally send us 2, 3, 4. All we ask everyone is to be patient. Sometimes the turnaround time can be up to 48 to 72 hours on patient reviews, but we do offer that. So this is the way we'd like to support our doctors and all clinicians that work with Adia Med. So we're going to talk a little bit specifically about Adia Med. Also, the parent company is Adia Nutrition. We're a publicly traded company, and the ticker symbol is ADIA. What that means is a lot of organizations that have to be listed, we have to be fully transparent. We have to follow certain regulations. Not only do we have to follow regulations within the medical field, right? But we also have to find it within the filing system of the SEC, right? Our world headquarters is in Winter Park, Florida. Once again, we've established a great deal of research and development within our group. Actively, we have several different patient conditions where we are meticulously recording their successes, and we would like to share that with you. If you'd like to know further information in great detail, you can also go to our website for further information as a great resource. It's adiamed.com. That's ADIAMED.com. We encourage you to please do your research. And then lastly, I'd like to thank everyone for your time. This is what the next steps are. You can actually book a consultation if you have questions, concerns, or if you're ready to move forward. You can simply go to a website. It's very, very easy to remember. It's stemcellpi.com. That's stemcellpi, so stemcellpi.com. Or you can call our National Director of Sales. This is Michael Maha there. That's 702-334-2571. You can call or text. If you'd like to schedule an appointment, or if you'd like to speak to other members of the team, such as Larry, the CEO, we will make him available for you. We are so excited to open this relationship with your community, and we'd like to especially thank all the efforts of Dr. Tony and his team to make this possible. Once again, if you wish to find more information and talk with Michael and the team, please simply go to stemcellpi.com or simply text or call. Mike, will you be available? Just nod your head. He's always available. Thank you so much, Michael. 702-334-2571. Thank you so much, Dr. Tony. And thank you, gentlemen and ladies out there. We look forward to hearing with you and ultimately working together for the best patient outcomes.
All right. Thank you so much, Larry, Jay, and Mike, for being here and giving that great presentation, very straight to the point. Doctors, you have asked for many things to enhance your practices in personal injury and in general practice. And so we haven't had any of this brought into the community. We're doing it now. We're endorsing this particular services from Larry, Jay, and Michael at Adia. And, no doubt we'll have everything posted right underneath the endorsement when we get it approved to be live on our community. And also, these gentlemen, professionals, will be floating around our community, answering questions, making comments, even contacting you to give you that information one-on-one. So be sure to welcome them into our community as their professional services are being endorsed. Okay, anybody need to say anything else?
No, I think we've covered everything. We do have clinics that, like we said, they can actually see these treatments being done at our clinics. We have 3 different ones throughout the country right now. We are still expanding. And I think it's a great additional income for each one of these doctors.
Yeah, no doubt. The thing I want to mention to our doctors too is also, make sure in an accident or anything at fault that you're working with an attorney for an evaluation of settlement, you need to document in your notes that this is related to the accident and this is what it's needed for this treatment, whether it be a shoulder, knee, elbow, back, neck, whatever you are you going to use it for, it has to be documented. And then it will usually be paid, and evaluated, hopefully 100% in its settlement payment for helping your patients out. It's only their rights to get health care in any accidents. That's why we all cover insurance to cover our butts. So it should be used. But, all right, so we appreciate all you being here today. No doubt we welcome you into our doctors community in the next day or so, and we appreciate your time and expertise. Okay, with that, Dr. Tony, your administrator and founder, hey, watch out for more things coming up. We're going to enhance our community as we grow each and every day and being the largest personal injury Facebook doctors community. All right, I will see you all around the community. Look out for the emoji sunglass guy. He floats around all over the place. That's how they know I'm there. All right, thank you, Larry from Florida. Thank you, Jay from Las Vegas, Nevada. And where are you at now, Jay? You in Florida now?
I am. I am in Florida. I'm in
Today you are, I
beautiful
think Larry
Tampa
said.
Bay.
Yeah, so all right, enjoy the weather, and we'll see you all around. All right, with this session is now ended. Thank you all, and we will talk to you later. Bye.
Thanks. Take care.